Okay, so one of the things we wonder about is the supplements you take after surgery. And there are people who are patients of mine who are a little wound up. They're a little tense. They're kind of a little obsessive compulsive, a little anal retentive, a little annoying. And so they will get this list of medicines. And sometimes they'll get a support person, and if the two of them are both wound up tight, then they'll be like, you know, D-Day with synchronize your watch, you know, at 1500 hours, you're going to get a calcium tablet. Ready? And go. 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 All right, now you got 15 minutes, and then we're going for the Pepto-Bismol. You know, and they get really tense about this stuff. And what I want to tell you is none of the medicines are important post-op. Okay, now take that in, take a breath. None of the medicines are important post-op. The surgery is everything. The medicines are icing on the cake. You don't need any of those medicines post-op. Now, they are kind of helpful, and we do want you to take them, but that list like you've got there, the spreadsheet, can I have it to show it on the video?
Sure.
Okay, now this is the spreadsheet that comes from Obesity Help, MGB Help, and we believe this essentially is kind of an invention of the devil. It's just silly, you know. You don't need this. I mean, if you want to do it, if you're an obsessive compulsive, you know, like I notice you're writing down that you don't need to do this. That's right. It's okay. If you want to do that, that's good, because otherwise you'll be bothering me with stuff that, you know. But all those medicines post-op, let's think about them. What are they? Well, there's some antacids. Okay, that's Prilosec and Tums and Pepto-Bismol. Why are you taking antacids? Well, because we cut through the stomach, we stapled it and sewed on it, and then we ask it to heal while it's being bathed in acids and digestive enzymes that would normally dissolve the stomach. So we figure, turn down some of that digestive power for a few days while you heal. Okay? Now, is it critical, according to that spreadsheet, that you get it at certain hours of the day and take it a certain way and all that thing? No. If you skip it because you're out watching a play or you're walking around and you go see Boulder Dam, so skip it. Don't worry about it. If you look at it, our results are spectacularly good. And taking some of those medicines kind of helps a little. And we recommend you take them, but not with tension and fear and worry and obsessive compulsive illness. Just relax. Now, one of the antacids that I use in my patients is something called Tums. That's calcium carbonate. Dr. Paragli, who I have tremendous respect for, prefers that his patients get calcium citrate. Okay? And the reason is because citrate is a good thing. It helps bind calcium in the gut and helps protect against kidney stones, which is good. We do get some patients who get kidney stones after our surgery, and we know that oral calcium helps protect against kidney stones, but calcium carbonate in Tums helps protect against kidney stones. And we recommend to patients who follow my advice, drink orange juice to get their citrate, because it's got citric acid in it.
And you put the citracel in that for fiber.
Okay, so for kidney stones, we like recommending orange juice. Okay?
How soon after surgery do you start the orange juice?
Okay, let me go back to this. Nothing's important after surgery.
Right, okay.
Nothing is important after surgery. Nothing's important I know, wait, just let me finish. It's not important after surgery.
Right.
So when is whenever.
Okay.
Right? Now, is it important to drink orange juice for the rest of your life after surgery? It's very important because this is a marathon, not a sprint. Nothing's important today other than giving thanks that your surgery went well. Nothing's important today. Everybody who has a spreadsheet and is worrying about this and writing stuff down is confused and off the mark unless you have nothing else to do, which is okay because, you know, otherwise you might be doing a crossword puzzle or something like that. So it's okay to do if you want to do it. It just doesn't help. It makes zero difference. The solution to your problem was yesterday's surgery, and the medicine doesn't make any difference. Now that's not quite true. Years of fiber, years of Tums, years of supplemental vitamins will protect you from some of the problems of the surgery. But today, it doesn't make any difference. Okay? Now, so what we do say, if you can, if it's convenient, take some Pepto-Bismol, take some Tums, take some Prilosec, because that's going to turn down the acid power in your stomach and let it heal. You don't need that. Most of you will heal fine. But we recommend it kind of like safety belts. You know, when you get in the car, you put your seat belts on. How many times have you put seat belts on when you fly in an airplane?
Every time.
Okay. So each of you have flown thousands of people. How many times has it been helpful?
Never.
Right. I've never been in an airplane crash. Has it helped? All right. So we give the medicine, but there's safety belts in an airplane. The most important part is the airplane and the pilot and the trip. That's the surgery. All the rest of this is, eh. Now, Dr. Paragli likes Citracal because of the citrate. I like Tums because you're much more likely to get an ulcer and gastritis after my surgery than kidney stones. And you can get citrate from orange juice, and orange juice is 1,000,000 times better for you because it contains all those other good vitamins and minerals. So, you're more than welcome to write everything down. You're more than welcome to have the spreadsheet and things like that if you want to for sport, you know, because you're busy or you're not busy and you have nothing else to do. My bias is I throw that away. I take some Tums. I take some Prilosec. I take some Pepto-Bismol. If you're out and about and you skip that, don't worry about it. Now, on the other hand, I have a guy from Florida. He called me about 6 weeks post-op. He had burning pain when he swallowed. He was having trouble. And I said, well, it sounds like you're getting an ulcer. Have you been taking any of the medicines I recommended? And he said, no, you told us we didn't have to take them. So he took the other extreme. There's one group of my patients who are intensely focused on, like, every word I say, you know, is from the fount of wisdom, the Oracle of Delphi. You know, wise old Dr. Rutledge is, you know, saying things. I want to catch everything, write it down, you know, because he's so full of it, smart. I mean, and then there's other people going, you know, guys mainly. They go, I don't think I'll do anything he says. And neither is the right approach. Instead, you're trying to heal up your stomach. Most of you are going to heal fine. You can do a little bit of extra to help it. And then for the rest of your life, remember what are the long-term risks. You could get an ulcer, you could get low iron, you could get low vitamins and minerals. So what do you want to do? You take some supplements, take some vitamins, once a year get your blood tested. It's very low maintenance, but it's not zero maintenance. It's not hard to live with an MGB. That's one of the beauties of it. Have you ever been to Weight Watchers?
Yes.
Isn't that's pretty annoying. It's hard work and weighing this and exchanges. This isn't hard. This is not hard. You take some Tums. Tums? You take a Prilosec once or twice a day for a couple of months just while you're healing. You take a little Pepto-Bismol if you can. If you don't like it, skip it. Easy, not hard.
Is Rolaids calcium carbonate?
We'll read on the box, but yeah. So I don't care if it's
Well,
Tums.
you can have the chewy ones that taste like
We don't
candy.
care. You can have anything. Who cares? Now, again, like, what about fiber? You were asking about fiber. Okay, fiber is very good for us. It's whether you had surgery or not, fiber is good for us. Research suggests that increasing fiber in our diet would decrease colon cancer and heart attack and stroke and obesity, high cholesterol, diabetes, gallbladder disease, all kinds of things. So thousands of studies have shown that fiber is good for us, and that there is good research saying how much fiber we need. Okay? And I'm going to give you an idea by reminding you the tablets of fiber you can buy in the grocery store are mostly 500 milligrams or half a gram. All right, and then the researchers have found that you should probably take in 32 grams of fiber a day. So if you're going to take it in tablets, that's 64 tablets a day. Okay, so I'm not suggesting, please don't get confused, please don't write this down. You know, Dr. Rutledge says take 64. I saw you shaking there. I saw your hand kind of heading towards it. I'm not saying you take 64. I'm saying this is a hint that lots of research says we need fiber. We need lots more fiber than we eat, so eat a healthy diet. And take my advice, take a little fiber. When? Right now. Quick, stat. 911. Has anybody got any fiber on them? Can I get a little fiber? No, we don't care. This week, who cares? It's for the rest of your life.
Right.
Nothing's going to happen if you miss out a fiber caplet today. On the other hand, for the next 40, 50 years, we know that fiber can help protect the lining of your stomach from ulcers. Okay, eat a healthy diet, take some extra fiber. If you look at our advice, we've designed it to be relatively easy to live with. We put a lot of things into those supplements, but we don't want to overburden you. It is kind of challenging to imagine keeping a Ziploc baggie with some fiber tablets, some Tums, and things like that as you go along. But we want you to be able to run this race for the rest of your life. I doubt that many people can run that spreadsheet for the rest of their life. Yeah. So we recommend, I mean, the guy who runs MGB Help's a really nice guy. Grizz, the guy from Canada, seems like a really nice guy. And there's lots of people who want that spreadsheet and talk about it all the time. And I'm constantly telling people to ignore it. But it's a little bit like, swatting ants. They just keep coming back. So we expect that this won't be the last time we'll talk about this spreadsheet. And there's nothing wrong with the spreadsheet. But my bias is it's unnecessary. It's focusing on something that won't make any difference.
It's my fault I sent it to them.
What's that?
It's my fault I sent it to her.
No, we all.
No, it's nobody's fault. It's not anybody's fault at all. I need to explain to you that those supplements are merely icing on the cake. The tremendous power of the surgery comes from the surgery itself. And then there are some potential side effects, so eat a little yogurt. Eat a healthy diet. Those are your best guidelines. Don't drink alcohol. Don't smoke cigarettes. And take a few supplements. But don't get so tense about the supplements that it ruins your life. Enjoy life. You're going to have a wonderful new life.
Can I tell you something that has nothing to do with supplements?
Sure, but can I turn off the video then?
Sure.
You're going to go on to something else then?
Yeah.
Have I said it enough to relax?
Yep.
Okay.
While you're trying that